What makes a true fellowship in musculoskeletal ultrasound? Could cheap, fast-track programs be putting patients and your license at risk? And are you building expertise or just buying a certificate? Today, at Your Practice, Your Money, where clinical success meets financial freedom, we will discuss about misleading fellowships, the hidden risk to patients and to the physical therapy profession. Let's dive in. Welcome back to another episode of Your Practice, Your Money, where clinical success meets financial freedom. I'm your host, Dr. Dimitrios Kostopoulos, and today we are tackling a serious issue that's making waves in the world of physical therapy and diagnostic imaging: the rise of low-quality so-called fellowship programs in musculoskeletal ultrasound. These programs advertise a shortcut to expertise, but what they are really offering could damage your credibility, your income, and worst of all, patient care. We'll break down what a real fellowship entails, the dangers of skipping mentorships, and how misleading credentials can backfire on your practice and your profession as a whole. And of course, we'll talk about the real solution: how to build a legitimate skill, clinical accuracy, and financial success through true mentorship and education. Let's start with the basics. What is a real fellowship? A fellowship is not just a series of weekend courses. According to the American Board of Physical Therapy Residency and Fellowship Education, it's called ABPTRFE, fellowship education includes structured didactic training, but more importantly, it requires mentorship. It's not optional. It is not vague. It is mandatory. So fellows must engage in supervised, real-time clinical training, and often involving dozens or hundreds of patient cases with expert feedback. That's how clinical mastery is built. That's how we protect patients. And that's how we elevate the physical therapy profession. So when a company offers a fellowship made up of 4 or 5 two-day courses with zero mentorship, zero feedback, and zero reporting oversight, well, that is not a fellowship. It is a shortcut, and shortcuts in healthcare lead to mistakes. So, what are the dangers of fake fellowships? Let's talk about what is at stake here. These programs graduate people who have not had a single supervised scan reviewed. They haven't been mentored in identifying pathology. They've never received corrections on how they write ultrasound reports. And yet they walk out with a fellowship title. The result: misdiagnosed tendinopathies, missed tears, false positives that send patients to unnecessary orthopedic consultations or even to surgeries, unnecessary surgeries. This isn't just clinically irresponsible. It is a liability. It puts the patient at risk, it puts the provider at legal risk, and it puts the physical therapy profession under scrutiny. These low quality programs harm us all. They dilute the value of real training. They create confusion in the marketplace, and they give ammunition to those who argue that PTs should not be doing diagnostics at all. Well, on the other hand, let's see what makes a real musculoskeletal ultrasound fellowship. Let's talk about what real education looks like. At the American Academy of Musculoskeletal Ultrasound, AAMU, we've built a program that's aligned with ABPTRFE standards. Yes, we teach the courses, classroom courses, online courses. Yes, we give you tools like our proprietary SonoScript app to make reporting easier. But we also do the hard work. We pair every single fellow with a board-certified mentor. You don't just passively absorb in a classroom setting. You actively scan. You write ultrasound reports, and most importantly, you get 150 of those reports reviewed by a board-certified mentor. They get corrected, they get improved, they get sharpened. That's how you build real clinical skill. You learn to accurately identify structures. You learn how to accurately recognize pathology and how to communicate your findings clearly in an accurate diagnostic report. Not only does this protect patients, it makes you more valuable in your practice. It increases your reimbursement and it makes your practice stand out as a place where diagnostic excellence lives. Let's connect also the dots to your money. The clinicians who complete the AAMU fellowship don't just walk away with a certificate. They walk away with a skill set that insurance companies value. Those professionals know how to bill appropriately, they know how to document clearly, and they get paid for the diagnostic work they do. A fast track mentorship free fellowship may be cheaper upfront, but in the long run, it costs more because your quality of work may be questioned, your diagnostic accuracy may be off, and your patients and payers may lose trust on you. Real fellowship training means real credibility, and credibility translates into reimbursement and long-term growth. So, what can you do if you are considering MSK ultrasound training? Ask the right questions. Does the program I'm looking to register in include mentorships? Are your scans reviewed? Are you trained to write appropriate and correct diagnostic level reports? Are your faculty credentialed experts with published research and clinical credentials? Well, don't settle for a marketing hype. Don't fall for low prices that come with high risk. And If you have already completed a low quality program, I'm telling you, it's not too late. You can still pursue a real mentorship, get your work reviewed, and elevate your skills the right way. You just have to contact the American Academy of Musculoskeletal Ultrasound, AAMU. Let's be clear. Our profession depends on quality, and the future of diagnostic testing in physical therapy depends on clinicians who are truly competent, not just credentialed. So protect your license, protect your patients, and protect the reputation of this incredible profession we share. If you're ready to make the leap from trained to truly expert, check out the American Academy of Musculoskeletal Ultrasound. And for tools to write reports quickly and accurately, take a look at SonoScript, our powerful MSK ultrasound reporting app. As always, thanks for listening to Your Practice, Your Money, where clinical success meets financial freedom. Please remember to subscribe on Apple Podcasts, Spotify, or YouTube. And visit us anytime at yourpracticeyourmoney.com for more insights, tools, and resources to move your practice forward. See you next time with another episode packed with practical solutions and bold truths. Until then, keep building clinical success and financial freedom. Take care.